All right, so today's date is November 18th, 2020. Patient's ID number is 2413. She's a 22-year-old female, no chief concern. The patient presents for nutritional counseling, and I just want to thank you for being here today and taking part of the 5-day diary.
You're welcome.
Yes, and so the patient is not currently taking any medications or has any diseases or conditions that would be of a concern for us today. The patient did, however, have some suspect caries on tooth number 2, 3, and 15. And so the purpose of this assignment is to look at the relationship of their diet and to compare that with their intraoral and extraoral findings. And taking a look, it looks like your plaque score was at 16%, which is pretty good. And then your caries risk was high due to those suspect decay areas. All right, so now we're going to look at your carb intake, and it looks like on November 6th you had some brown rice, and that's 35 grams of carbs, and then on November 7th you had a chicken sandwich, and that's also 35 grams of carbs, and then on November 8th you had a cheesy breadstick, and that's 54 grams of carbs, so that's a little higher. And then on November 9th, you had a packet of M&Ms, and that is 21 grams of carbs. And on November 10th, you had a Nutter Butter package, and that is 37 grams of carbs. And so, kind of looking at that, do you think there's any areas where you want to cut out some of those carbs and replace it with healthier, nutritious options?
Instead of using like a white bun for my chicken sandwich, I could use a wheat bun.
Yeah.
Or packing a lunch instead of buying food all the time.
Absolutely, that would be a great option. And then also, just to ask you, how frequent are you snacking throughout the day versus just having your meals, breakfast, lunch, and dinner?
So typically on the weekends, I just have breakfast, lunch, dinner.
Mm-hmm.
But during the week with school, I am snacking more often than I probably should be.
Yeah.
But on the weekends, I try and, I'm so busy, I only typically have 3 meals.
Right. So yeah, that's good that you are having those 3 meals a day, because when you have the more frequent intake, it just exposes your teeth more to those acidic, sugary foods, and so frequency is more relevant than quantity, and high frequency decreases the ability of calcium and phosphate to remineralize the teeth and between the episodes of your snacking. Does that make sense, kind of?
Yeah, so I don't want to have my snacks throughout the day. I want to have them with my meal.
Yeah, you can have snacks once in a while, but yeah, more towards the meal time, so your teeth aren't getting exposed as much.
Okay.
And also, just taking a look at some treats that you're eating, like the Twix bar and the M&Ms. So those have 16, 18 grams of sugar, which are pretty high in sugar. Do you think, is that a priority for you to have those?
Well, no, it's a want. It's not
right.
a priority.
It's good to want those things like once in a while to have those treats, but maybe once a week, twice a week, kind of limiting those sugars, or having some substitute kind of sugars would be good.
Okay.
All right, so now we're gonna just take a look at the dental caries process. And there's 4 factors that involve this process. One is tooth resistance, so how susceptible the tooth is. And then there's microorganisms, and these are bacteria that causes cavities, like the streptococci, and in larger cavities have a lactobacillus. And then there's our diet, so the cariogenic diet. And those are foods that are starchy, sticky, sugary, and as well as pop, those sticky beverages. And then there's the fermentable carbohydrates, which are sucrose, glucose, fructose, and cooked starches. What we were just kind of talking about, those carbs in your diet. And when all these come together, it kind of forms a cavity. And there's also salivary factors, so if you have more so a dry mouth, that bacteria and acid can more so stick to your teeth and form that decay. And then kind of just taking a look, so when that sugar combines with that bacteria, it forms an acid. And when those acid clings to the healthy tooth surface, it starts performing that decay process. And if you look at this, here's the healthy tooth surface, and then when it's in that initial phase, it just starts breaking through that enamel, and we can do things like providing fluoride treatment and reducing those sugars in our diet to help prevent that. And when we give that fluoride treatment, it remineralizes the tissues and it inhibits the demineralization process of that tooth. Does that kind of make sense?
Mm-hmm. So I want fluoride.
Yep, fluoride's very good. It will help prevent decay. All right, so now I'm gonna give you some tips for reducing that acid forming bacteria in your mouth. So you could rinse with water to help remove food after eating. Brush and floss at bedtime, brush twice a day for 2 minutes, once in the morning, once at night. Eating snacks that do not promote the bacteria, so some good examples of that would be some carrots, broccoli. Fruits are good, but definitely limit those. I noticed that you did have a lot of fruits, strawberries, and those do have the sugars in them. So fruits are good, but you just want to limit the intake of them. And then do you like chewing gum?
Yeah.
So sugar-free gum would be great to help stimulate the saliva to protect your teeth from decay. And then since you do have a lingual retainer, have you used a floss threader?
No.
Okay, so I can show you how that works, and those would be great getting in between your teeth under your retainer, so that area is nice and clean. All right, so now we're going to talk about your periodontal classification. So you are currently at class 1, grade A. You don't have any bone loss, so this is good and healthy, and we want to keep it that way so we can incorporate some vitamins to keep your bone levels nice and healthy. And some of those include vitamin A, and this just helps to keep the mucous membranes healthy. It prevents dry mouth. So some examples of the food groups for that would be some green veggies, orange colored fruits like carrots, oranges, anything you can think of. And then vitamin C strengthens the gums, soft tissues, and protects against gingivitis. And some of those food groups would be some citrus fruits, potatoes, and leafy greens. And then our vitamin D helps the body absorb calcium, which boosts the bone mineral density. And some examples of those would be fish, tuna, mushrooms, and milk. So it looks like you are incorporating some of these food groups, but some of these vitamins, but do you think you want to add more to your food diet?
I could definitely have more vegetables.
Yeah, definitely.
I like fruits. I'm
Yeah,
not a
those
huge
are
fan of
good.
vegetables, but I should incorporate them more probably.
Yeah, those citrus fruits are good, and those leafy greens, green veggies. Yeah, definitely make a plan to do that. And then, all right, so I just wanted to thank you for being here today and allowing me to look at your diet for the past 5 days and just to kind of analyze that. Do you have any last questions?
No.
All right, so we'll check back in with you in 6 months and see how you're doing.
Thank you.
Mm-hmm.